Abdominal belly. Pain is pain or discomfort that is felt in the part of the trunk below the ribs and above the pelvis. It comes from organs within the abdomen or organs adjacent to the belly. It is caused by inflammation, distention of an organ, or by loss of the blood supply to an organ. What's up, fellow human? I'm Joshua, and this is the Stomach Health Channel, where I'm going to discuss different facts, remedies, and such about your gut. Now, let's get on with the video. In irritable bowel syndrome, IBS, it may be caused by contraction of the intestinal muscles or hypersensitivity to normal intestinal activities. Symptoms associated with it may include bloating, belching, gas, flatus, farting, indigestion, discomfort in the upper left or right, middle or lower left or right abdomen, constipation, diarrhea, GERD, gastro-esophageal reflux disease, heartburn, chest discomfort, pelvic discomfort. The cause of abdominal pain is diagnosed on the basis of its characteristics, physical examination, and testing. Occasionally, surgery is necessary for diagnosis. The medical diagnosis of the cause is challenging because the characteristics may be atypical. Tests are not always abnormal. Diseases causing pain may mimic each other, and the characteristics of the pain may change over time. Medical treatment depends upon the patient's history of the disease or other health conditions that may be the cause. Abdominal pain causes. Abdominal pain is a common symptom, and most people have experienced some sort of abdominal pain, belly or stomach pain. Causes of more serious causes of abdominal pain include bloody stools, lactary stools, dehydration, painful urination, lack of urination, abrupt cessation of bowel movements, dehydration. What is abdominal pain? Abdominal pain is felt in the abdomen. The abdomen is an anatomical area that is bounded by the lower margin of the ribs and diaphragm above, the pelvic bone, pubic ramus below, and the flanks on each side. Although pain can arise from the tissues of the abdominal wall that surround the abdominal cavity, such as the skin and muscles, the term abdominal pain generally is used to describe discomfort originating from organs within the abdominal cavity. Organs of the abdomen include the stomach, small intestine, colon, liver, gallbladder, spleen, and pancreas. Technically, the lowermost portion of the area, described previously, is the pelvis, which contains the urinary bladder and rectum, as well as the prostate gland in men, and the uterus, fallopian tubes, and ovaries in women. Often, it can be difficult to know if lower abdominal pain is coming from the lower abdomen or pelvis, pelvic pain. Occasionally, pain may be felt in the belly, even though it is arising from organs that are close to, but not within, the abdominal cavity, for example, conditions of the lower lungs, the kidneys, and the uterus or ovaries. On the other hand, it also is possible for pain from organs within the belly to be felt outside of it. For example, the pain of pancreatic inflammation may be felt in the back. These latter types of pain are described as referred because it does not originate in the location that it is felt. Rather, the cause is located away from where it is felt, i.e., it is referred to a different area. Abdominal pain is caused by inflammation of an organ, for example, appendicitis, diverticulitis, colitis by stretching or distension of an organ, for example, obstruction of the intestine, blockage of a bile duct by gallstones, swelling of the liver with hepatitis, or by loss of the supply of blood to an organ, for example, ischemic colitis. To complicate matters, however, abdominal pain also can occur without inflammation, distension, or loss of blood supply. An important example of the latter is the irritable bowel syndrome, IBS. It is not clear what causes the belly pain in IBS, but it is believed to be due either to abnormal contractions of the intestinal muscles, for example, spasm, or abnormally sensitive nerves within the intestines that give rise to painful sensations inappropriately, visceral hypersensitivity. This often is referred to as functional pain because no recognizable specific abnormality to account for the cause of the pain has been found, at least not yet. Signs, symptoms, locations, types, and severity of abdominal pain. Doctors will ask you a variety of questions about your belly pain in order to help find the possible causes of it. For example, how did the pain begin? If it comes on suddenly, this may suggest a problem with an organ within the belly. For example, the interruption of the supply of blood to the colon, ischemia, or obstruction of the bile duct by gallstone, biliary colic. Where is the pain located? Appendicitis typically causes discomfort in the middle of the abdomen and then moves to the right lower abdomen, the usual location of the appendix. Diverticulitis typically causes discomfort in the left lower abdomen where most colonic diverticula are located. Discomfort from the gallbladder, biliary colic or cholecystitis, typically is felt in the middle, upper abdomen, or the right upper abdomen near where the gallbladder is located. What is the type and pattern of the pain? Is it severe, crampy, steady, or does it wax and wane? Obstruction of the intestine initially causes waves of crampy pain due to contractions of the intestinal muscles and distention of the intestine. True cramp-like pain suggests vigorous contractions of the intestines. Obstruction of the bile ducts by gallstones typically causes steady, constant, upper belly pain that lasts between 30 minutes and several hours. Acute pancreatitis typically causes severe, unrelenting, steady pain in the upper abdomen and upper back. The pain of acute appendicitis initially may start near the umbilicus, but as the inflammation progresses, it moves to the right lower abdomen. The character of pain may change over time. For example, obstruction of the bile ducts sometimes progresses to inflammation of the gallbladder, with or without infection, acute cholecystitis. When this happens, the characteristics change to those of inflammatory pain. Well, what do you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. How long does the pain last? The discomfort of IBS typically waxes and wanes over months or years and may last for years or decades. Biliary colic lasts no more than several hours. The pain of pancreatitis lasts 1 or more days. The pain of acid-related diseases, gastro-esophageal reflux disease, GERD, or duodenal ulcers, typically occurs over a period of weeks or months that is worse, followed by periods of weeks or months during which it is better, periodically. Functional pain may show this same pattern of periodicity. What makes the pain worse? Pain due to inflammation, appendicitis, diverticulitis, cholecystitis, and pancreatitis typically is aggravated by sneezing, coughing, or any jarring motion. Individuals with inflammation prefer to lie still. What health conditions make abdominal pain worse or better? What relieves the pain? The pain of IBS and constipation often is relieved temporarily by bowel movements and may be associated with changes in bowel habits. Pain due to obstruction of the stomach or upper small intestine may be relieved temporarily by vomiting, which reduces the distension that is caused by the obstruction. Eating or taking antacids may temporarily relieve ulcer pain from the stomach or duodenum, because both food and antacids neutralize the acid that is responsible for irritating the ulcers and causing the pain. Pain that awakens a patient from sleep is more likely to be due to non-functional causes and is more significant. Other associated symptoms that accompany abdominal pain may suggest: fever suggests inflammation or infection. Diarrhea or rectal bleeding suggests an intestinal cause. Fever and diarrhea suggest inflammation of the intestines that may be infectious or non-infectious. How is the cause of abdominal pain diagnosed? Doctors determine the cause of the pain by relying on its characteristics, physical signs, and other accompanying symptoms. Findings on physical examination, medical laboratory, radiological and endoscopic testing, surgery. How is the cause of abdominal pain diagnosed? Doctors determine the cause of the pain by relying on 1. Characteristics, physical signs, and other accompanying symptoms. 2. Findings on physical examination. 3. Laboratory, radiological, and endoscopic testing. 4. Surgery. What exams and tests help diagnose the cause of abdominal pain? Physical examination. Examining the patient will provide the doctor with additional clues to the cause of the pain. The doctor will determine 1. The presence of sounds coming from the intestines that occur when there is obstruction of the intestines. 2. The presence of signs of inflammation by special maneuvers during the examination. 3. The location of any tenderness. 4. The presence of a mass within the abdomen that suggests a tumor, enlarged organ or abscess, a collection of infected pus. 5. The presence of blood in the stool may signify an intestinal problem, such as an ulcer, colon cancer, colitis, or ischemia. For example, finding tenderness and signs of inflammation in the left lower abdomen often means that diverticulitis is present, while finding a tender, inflamed mass in the same area may mean that the inflammation has progressed and that an abscess is formed. Finding tenderness and signs of inflammation in the right lower abdomen often means that appendicitis is present, while finding a tender mass in the same area may mean that the inflammation has progressed and that an abscess is formed. Inflammation in the right lower abdomen, with or without a mass, also may be found in Crohn's disease. Crohn's disease most commonly affects the last part of the small intestine, usually located in the right lower abdomen. A mass without signs of inflammation may mean that cancer is present. While the health history and physical examination are vitally important in determining the cause of abdominal pain, other medical tests often are necessary to determine the cause. Laboratory tests. Laboratory tests such as the complete blood count, CBC, liver enzymes, pancreatic enzymes, amylase and lipase, pregnancy test, and urinalysis are frequently ordered. An elevated white count suggests inflammation or infection, as with appendicitis, pancreatitis, diverticulitis, or colitis. A low red blood cell count may indicate a bleed in the intestines. Amylase and lipase, enzymes produced by the pancreas, commonly are elevated in pancreatitis. Liver enzymes may be elevated with gallstone attacks or acute hepatitis. Blood in the urine suggests kidney stones. When there is diarrhea, white blood cells in the stool suggest intestinal inflammation or infection. A positive pregnancy test may indicate an ectopic pregnancy, a pregnancy in the fallopian tube instead of the uterus. Plain X-rays of the abdomen. Plain X-rays of the abdomen also are referred to as a KUB because they include the kidney, ureter, and bladder. The KUB may show enlarged loops of intestines filled with copious amounts of fluid and air when there is intestinal obstruction. Patients with a perforated ulcer may have air escape from the stomach into the abdominal cavity. The escaped air often can be seen on a KUB on the underside of the diaphragm. Sometimes a KUB may reveal a calcified kidney stone that has passed into the ureter and resulted in referred abdominal pain or calcifications in the pancreas that suggest chronic pancreatitis. Radiographic studies. Ultrasound is useful in diagnosing gallstones, cholecystitis appendicitis, or ruptured ovarian cysts as the cause of the pain. Computerized tomography, CT, of the abdomen is useful in diagnosing pancreatitis, pancreatic cancer, appendicitis, and diverticulitis, as well as in diagnosing abscesses in the abdomen. Special CT scans of the abdominal blood vessels can detect diseases of the arteries that block the flow of blood to the abdominal organs. Magnetic resonance imaging, MRI, is useful in diagnosing many of the same conditions as CT tomography. Barium X-rays of the stomach and the intestines, upper gastrointestinal series, or UGI, with a small bowel follow-through, can be helpful in diagnosing ulcers, inflammation, and blockage in the intestines. Computerized tomography, CT, of the small intestine can be helpful in diagnosing diseases in the small bowel, such as Crohn's disease. Capsule enteroscopy uses a small camera the size of a pill swallowed by the patient, which can take pictures of the entire small bowel and transmit the pictures onto a portable receiver. The small bowel images can be downloaded from the receiver onto a computer to be inspected by a doctor later. Capsule enteroscopy can be helpful in diagnosing Crohn's disease, small bowel tumors, and bleeding lesions not seen on X-rays or CT scans. Endoscopic procedures. Esophageal gastroduodenoscopy, or EGD, is useful for detecting ulcers, gastritis, inflammation of the stomach, or stomach cancer. Colonoscopy, or flexible sigmoidoscopy, is useful for diagnosing infectious colitis, ulcerative colitis, or colon cancer. Endoscopic ultrasound, EUS, is useful for diagnosing pancreatic cancer or gallstones if the standard ultrasound or CT or MRI scans fail to detect them. Balloon enteroscopy, the newest technique, allows endoscopes to be passed through the mouth or anus and into the small intestine, where small intestinal causes of pain or bleeding can be diagnosed, biopsied, and treated. Surgery. Sometimes, diagnosis requires examination of the abdominal cavity, either by laparoscopy or surgery. I know it's unbearable to bear stomach pains, so I may have something that might help you. Pepto-Bismol. Well, I'm not sponsored. It's just an affiliate link where I get a commission every time someone buys using my link on the description. So Pepto-Bismol is known worldwide and is a multi-symptom relief medicine. If your stomach hurts, chances are Pepto-Bismol would be able to relieve it. Don't just take my word for it. It has 10,000 5-star ratings on Amazon. Not to mention, it's #1 pharmacist recommended brand for upset stomachs. So what are you waiting for? Fix that painful stomach. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.